Hello, I am Sari Kui, Senior Engineering Major with the Women's Tennis Team, and welcome to the Seattle U Athletics Medical and Safety Education Module. This education module will serve as the NCAA mandated concussion education requirement, as well as provide education in other key health safety areas. Upon completion of this module, be sure to sign the Certification of Concussion Safety Protocol document, which is collected by the sports medicine staff and submitted to the WAC conference office. The education module is required by all athletics department student athletes, coaches, and staff, including part-time, graduate assistants, volunteers, and clerical staff. It is required to be completed by the first day of practice or the first day of class, whichever occurs first. As previously mentioned, I will discuss a few key areas of student-athlete health and safety, the first of which will be concussion safety, including the university policy. Next, I will discuss sickle cell trait and the NCAA requirements regarding testing and participation. I will also discuss the Independent Medical Care Policy, which is a new NCAA measure regarding the healthcare authority of the medical team. Lastly, I will review important aspects of the emergency action plans for the SU athletic facilities, including important contacts and phone numbers. Ready? Let's begin. A concussion is a complex pathopsychologic process affecting the brain, which is induced by traumatic biomechanical forces secondary to direct or indirect forces to the head. A concussion is caused by a blow or jolt to the head that disrupts the function of the brain. It can result in a wide range of physical, cognitive, emotional, and/or sleep-related symptoms. All head injuries that are recognized by or made known to the athletic training room staff that display one or more concussion-like symptoms or signs will be initially assessed by an athletic trainer. The athletic trainer will perform a comprehensive examination as well as establish an appropriate action that is in the best interest of the overall well-being of the student athlete. Signs or symptoms of concussions that are severe in nature, worsen over time, or result in loss of consciousness for over 30 seconds will require an immediate referral to emergency care. In all cases, a full injury evaluation will be documented, which will include an overall assessment of the nature and intensity of the symptoms, balance, motor function, and memory testing. For every student athlete who has been diagnosed to have a concussion, a member of the team physician staff will be consulted to jointly establish an immediate and long-term care plan, also consisting of return to play criteria. Concussions can occur in any sport or even as a result of an accident during normal day activities. A student athlete that is sent home the day of an injury with a documented concussion will have very specific home care and emergency referral instructions to give to both the student athlete and a roommate or other person who will have close observation of the injured athlete. If an injury that causes an impact to the head or a rapid motion of the head and neck is witnessed, followed by the athlete exhibiting changes in behavior, then the athlete must be immediately removed from activity and evaluated by an appropriate sports medicine provider. Common observable signs by coaches, teammates, or others are athletes who appear dazed, stunned, confused, forgets plays or assignments, is unsure of their surroundings, slow to respond, unconscious, or exhibits personality changes or memory loss from recent events. Students who have had a head injury and reports one or more of the following symptoms should also be evaluated for a concussion. They may report a headache or pressure in the head, nausea, vomiting, dizziness, blurry vision, sensitivity to light or noise, feeling in a fog, feeling slow, memory problems, confusion, or just do not feel right. Each concussion is different, and thus it is very hard to predict recovery time. The average concussion will have symptoms that last 7 to 10 days, but it is not uncommon for some concussions to last much longer, from months to a year. The athletic trainer and team physician will monitor symptoms daily and will only progress a student athlete when they are symptom-free and it is safe to do so. Seattle U Sports Medicine conducts a computer-based neuropsychological test which measures a person's baseline and can be used to compare to testing done after a head injury. Unlike popular thought, it is not used to diagnose a concussion and is only used as a small piece of information when returning an athlete to participation. Seattle University's student-athlete concussion policy has both a return to learn and return to play component. In the return to learn policy, each concussion is communicated, with student-athlete permission, to the coach, academic coordinator, professors, and sometimes a disability center. As with other medical conditions of all SU students, various accommodations can be made to both protect the academic success of the student and, more importantly, protect the general health of the student. Education is one of the best forms of prevention. Education of proper form, technique, and equipment usage can help reduce concussions. The NCAA provides great fact sheets for both coaches and students alike. The fact sheet is required material to be given to each student athlete after a concussion per the SU concussion policy. The concussion policy is located online and is provided to all student athletes before each season. Sickle cell trait is an inherited condition of the oxygen-carrying protein hemoglobin in the red blood cells. It is not a disease and cannot be transmitted from person to person. Sickle cell trait is a genetic condition present in over 3 million Americans. Although sickle cell trait is most predominant in individuals with African American, Mediterranean, Middle Eastern, Indian, Caribbean, and South and Central American descent, persons of all races and ancestry may test positive for sickle cell trait. Sickle cell trait is usually benign, but during intense, sustained exercise, a lack of oxygen in the muscles may cause the red blood cells to change from a normal disc shape to a crescent or sickle shape. These sickle cells can accumulate in the bloodstream and logjam blood vessels, leading to collapse from the rapid breakdown of blood-starved muscles. The NCAA and Seattle University mandate that all NCAA student athletes have knowledge of their sickle cell trait status, show proof of a prior test, or sign a waiver before participating in any intercollegiate athletics event, including strength and conditioning sessions, practices, competitions, etc. Seattle University Department of Athletics offers sickle cell trait screening to all student athletes. Student athletes who have sickle cell trait will continue to have it for life. However, with appropriate education, supervision, recognition, and accommodation, successful participation at all levels is possible. It is very important to immediately stop the activity of an individual suspected of having an acute sickling episode and seek out immediate medical attention. Known athletes with sickle cell trait should be given a more gradual regimen during preseason, adequate rest during workouts, a limit of 3 minutes for all-out exertion, no participation when sick, proper hydration, and use of caution and/or modifications in workouts at high altitude. Further information on sickle cell trait and the NCAA regulations discussed can be found online at ncaa.org under Health and Safety. Independent medical care is recent Power 5 legislation opted in by the WAC. It requires institutions to provide an environment in which the medical providers, such as athletic trainers and team physicians, can make appropriate healthcare decisions in the best interest for the welfare of student athletes that is free of outside pressure, conflict, or other factors that could negatively affect the process. The two primary requirements for institutions to comply with this legislation is following the administrative structure to medical care and the designation of a healthcare administrator. The department administrative structure must give the unchallengeable and autonomous authority of primary athletics healthcare providers, which is defined as the team physicians and athletic trainers, to have final decision-making authority for the diagnosis, management, and return to play determinations for student-athlete care. The legislation also requires the designation of an athletics healthcare administrator to oversee a school's athletic healthcare administration and delivery. The athletics healthcare administrator will play an administrative role serving as the primary point of contact to ensure that schools are compliant with the NCAA health and safety legislation and inter-association recommendations. Seattle University supports the role of coaches and their positive impact on the students. They often have unsurpassed expertise in their sport within the department, and their input in the medical care process is valuable. All coaches are encouraged to provide any useful information that can help the medical staff in decision-making and forming a proper plan. It is, however, also important that coaches do not attempt to diagnose or treat medical issues themselves, make independent referrals to outside medical providers, discourage any student-athlete from seeking medical care for an issue, or disregard the restrictions placed on the participation of student-athletes by the medical staff. Seattle University has incorporated the NCAA independent medical care policy within the institution's sports medicine policy and is required to adhere to it. Non-adherence to this policy would be an NCAA violation and reported as such. Lastly, let's discuss emergency planning and related materials. The Sports Medicine Department develops emergency action plans to help provide education and assistance when dealing with athletic-related emergencies. These plans have been put in place multiple times a year in many sports for various medical emergencies. In this section, we will review emergency personnel, emergency communication, and written emergency action plans. First, who is the emergency personnel involved in the care of an injured athlete? The personnel assisting in the care of an injured student-athlete is often multiple individuals. It can be a coach, an athletic trainer, physician, teammate, staff member, or local emergency service. It is important to know your surroundings and the personnel you have available to you at a given location. What would you do in the event of an emergency? How would you activate emergency services? That brings us to communication. Each sport should ensure that they have a working and charged cell phone at their practice or competition location. On campus, it is best to call the Public Safety Office, who has direct access to various emergency services and can assist in the coordination of response. They are also often equipped with AED units and other emergency equipment. From a cell phone, you would call 206-296-5911. If you do not have this number stored in your phone, I would recommend you doing that now. From a campus landline, the extension is 5911. At any other location, or in the event that this number is not known, simply dial 911. Also, take note of emergency call boxes, which are located throughout Seattle University. For more specific emergency action plans and directions, please visit www.goseattleu.com and proceed to the Sports Medicine section. There you will find an emergency planning. There are also action plans posted at various venues around campus, such as the Performance Center and Logan Field during competitions. A link with this information is sent to each team at the beginning of the year. The NCAA requires at least one institutional staff member certified in CPR and AED to be present at any time that a student-athlete is participating in physical accountable related activity. Therefore, we encourage all coaches to have and maintain a CPR certification. It is a great life-saving skill too. If you need help obtaining your certification, please contact an athletic trainer. Thank you very much for following along in the Seattle University's education module. Please remember to sign the Certification of Concussion Safety Protocol sheet. This must be completed by all students, staff, and coaches before your first day of practice or the first day of classes, whichever is earlier. If you have any questions with this material, please contact a member of the sports medicine team. Go Red Hawks!